What is your diagnosis of this case? What do you diagnose this case as? Okay. Is it leukoderma or something else? What if I say it was a case of alopecia areata? Can you believe that it was a case of alopecia areata? Right? What happened is this patient went to a doctor with a complaint of alopecia areata, and that doctor gave Tikshna Lepa for external application. Usually, when Tikshna Lepas they are advised, when they are applied, they should be monitored. There will be boils. Once they start coming, then it should be stopped, and then we have to proceed with healing, and then Keshavardhan and all to be given. But here, what happened? Patient was asked to continuously apply that Tikshna Lepa. When wounds are formed, then it was treated with modern medicine, I think. And then once they are healed, again the Lepa, that Tikshna Lepa was recommended, and patient kept on doing this over a period of time, 1.5 to 2 months. And then by the time, what happened? The entire tissue became fibrous. There was complete loss of the tissue, and it turned fibrous completely. Right? It turned fibrous. Now patient is, even the condition is not suitable for grafting hair. Right? Hair implantation is also not possible at that site. So what went wrong? Dosha assessment, right? Dosha assessment was not correct, because dosha assessment is the most important aspect of clinical practice, particularly Ayurveda dermatology. Namaste. Myself, Dr. Mahesh Savalagimath. I am practicing Ayurveda dermatology and teaching Ayurveda since 2008. Welcome to my channel, Dr. Mahesh speaking. And in this video, we are going to discuss about clinical assessment of dosha in dermatology, right? In skin disease, right? Because assessment of dosha is the most important aspect of clinical practice. If you watch my previous video, there you will see me saying that Samprapti Vighatan is the most important, right? So that is the first step. Samprapti Vighatan, that is the root I told you, base. Next step is dosha assessment, right? So dosha assessment is very, very important, because based on this only the chikitsa is determined. Based on this only the disease name is determined. Based on this only nature of the disease is determined. So all aspects of skin diseases particularly depend on the association of dosha. It's true with all the diseases, but when it comes to dermatological practice, at that time this becomes very, very important, because Acharya Charaka says that na chakinchidasti kustam ekadosha prakopa nimittam. Right? In Samprati, we have seen that all the doshas at once they get aggravated. So, nacha kinchidasti kustam ekadosha prakopa nimittam. There will be no, there is not a single kushta, that is skin disease, which is caused due to ekadosha prakopa. Right? Even if it is there, astitu kalu samana prakritinamapi kushtanam dosha amshamsha vikalpa anubandha sthana vibhagena vedana varna samsthana prabhava nama chikitsita visheshaha. But he says, even if there exists a ekadosha skin disease, for example, there are explained, no, we get Kapala Kushta, Udumbar Kushta, Mandala Kushta, like that, right? Ekadosha. But that is also Tridosha only, and that Ekadosha Kushta only, because of change in the pathology, change in the etiology, change in the variation, or like Shita Vruddhi, Ushna Vruddhi, Drava Rupa Vruddhi, right? Ghana Rupa Vruddhi, like Dravyata Vruddhi, Gunata Vruddhi, Karmata Vruddhi. Those variations are going to determine the disease, right? What he says, Dosha Amshamsha Vikalpa. Dosha Amshamsha Vikalpa means this what? Whether it is Ruksha Guna dominant, whether it is Sita Guna dominant, Vata is there. If it is Pitta is there, whether it is Ushna dominant, or whether it is Sneha dominant, or whether it is like Paka dominant, like that, right? If it is Kapha, whether it is Dravyataha more, like Ghanata is there, or Guruta is there, whether Dravata Vriddhi is there, right? Likewise. So when these vary, and Anubandha, what dosha is associating with that, and because sthana, where it is affected, which dhatu it is affecting, and which part of the body it is affecting, based on that, what will happen? What will become Vishesha? Specific Vedana. Suffering will become different. Varna, clinical presentation, color changes and all. samsthana, the lesions, morphology of the lesions, presentation, swabhava or prabhava, nature, whether it is fast spreading, slow in spreading, right? Those, that nature, whether it penetrates into deeper tissues, it goes to, gambhira dhatus, whether it affects other systems. This is the prabhava. Name of the disease, like for example, Sidma Kushta is Vata Kapha, Kitiba Kushta is Vata Kapha, Eka Kushta is Vata Kapha, Charma Kushta is Vata Kapha, right? All are Vata Kapha Kushta only, but name is different. Nama. Why name is different? Because their Vedana, Varna, Samsthana, Prabha, all are different. So when these all become different, at that time, Chikitsita Visheshaha, Chikitsa also becomes different. So that when dosha amshamsha kalpana is done, at that time disease itself changes, right? Sidma, Kitiba, Charmakushta, Ekakushta, you can see they all are completely different. They all are completely different. Yet they are Vata Kapha Kushta. Yet they are caused by Vata and Kapha dominance only, right? Why they are changing? Why the clinical presentation is changing? Because the amshamsha kalpana and association of pitta and vata, other doshas, like if it is vata dominant, then vata dominant pitta, vata dominant kapha, or vata pitta dominant kapha, or vata kapha dominant pitta. This association, anubandha, when it changes, the clinical presentation changes. When clinical presentation changes, 100%, the name of the disease also changes. Even if we are not able to diagnose the name of the disease, so even if it is Vata Kapha Kushta, when presentation is changing, the chikitsa should also change. Means entire chikitsa is dependent on the dosha association, and their assessment plays very, very important role in successful practice of Ayurveda dermatology. So that is why don't skip the video, right? Don't fast forward. Watch it till the end. Actually, if you want to practice Ayurveda, it's not only going to help you practice Ayurveda dermatology, but it will give you 100%. It will give you idea about how to assess dosha in other than skin diseases, right? So don't skip. So for example, we will take psoriasis, right? In this video, we will take example psoriasis as example, and we will discuss, right? These are the psoriasis clinical presentations, right? 4 patients are 1, 2, 3, 4, right? They must and should be diagnosed as psoriasis. They must and should be diagnosed as psoriasis. I diagnose them in Ayurveda as Sigma. Some people diagnose it as Kitiba, some diagnose it as Eka. It's not necessary because name is not going to make the difference, right? The dosha association and their which gunas are increased, that is going to make the difference. Based on that, we are going to plan the treatment, right? Because in text we get Samanya Chikitsa, right? In text we do not get like Sigma Chikitsa is this, Eka Kushta Chikitsa is this, or Kitiba Kushta Chikitsa is this. No, we don't get like that. We get Samanya Chikitsa only. Breaking that Samanya Chikitsa or understanding that Samanya Chikitsa, what should be suitable for Sigma, what is suitable for Kitiba, that makes the difference. And that too particularly, what type of presentation of Sigma, which type of treatment should be used, or which type of medicine should be used. All this depends on the dosha assessment, right? So when we look into this, we need to study thoroughly about doshas. Then how to study them? How to study them? From where we get the references? We get reference. We'll discuss only one Vaataja selections. Otherwise, it will become lengthy, and you may run out of in between the video, right? So that's why I don't want to bore, right? I will give you idea. Then you can exactly same thing you can do just as a in your home, right? It's very easy. So we will take Vaataja selection. Now, what Acharya says, Charaka in Chikitsasana says, Rauksham Shosha Stodaha Shulam Sankochanam Tata Ayamaha Parusham Kharabhavo Harshaha Shavarnatvam Cha Pushteshu Vatalingam. What he says in Chikitsasana, these are the Vaataja Lakshanas which are seen in Pushta or skin disease. What are they? Ruksha, that is dry. Shosha, that is, sorry, Shosha, that is loss of tissue. Like in that first alopecia areata patient I shown you, tissue is lost, right? So the pricking type of pain, sankocha, contractions will be there. Ayama, stretching. Whenever there is sankocha, adjacent to that, there will be ayama. Parushya, they are rough. Harabhava, they are coarse. Rough and coarse are a little bit different, right? Coarse means something like, we are touching like, imagine sandpaper, right? Touching sandpaper is coarse. Harsha, that is Roma Harsha, articulation will be there, and hyperpigmentation. Shava and Tvam, these are the Lakshanas. Whether only these Lakshanas are enough to assess Vata in any skin disease, or we need to borrow something like that. So it's always better. We should go with more options. For that, I practically use Kapala Kushta because Kapala Kushta is explained as Vata Pradhana Kushta or Vaataja Kushta only, right? So from Kapala Kushta, we can understand that what are the other Lakshanas that can be seen in Vata dominant skin presentations, right? So we'll see that. Now, what is the Lakshana? What are the Lakshanas seen in Kapala Kushta? Ruksha Aruna Parushani, Vishama Vishrutani, Karaparyantani, Tanuni, Udvrutta Bahistanuni, सुप्तवत् सुप्तानि शीतलोमाचितानि निस्तोदबहुलानि अल्पकण्डू अल्पकण्डू दाह पूय लसिकानि आशुगति समुत्थान भेदिनि जन्तुमन्ति कृष्णारुण कपालवर्णानि च कपालकुष्ठानि इति विद्यात्. These are the lakshanas. So in this, for explaining, I will take few of the lakshanas which we can use in the other slides where we are assessing these lakshanas. The important ones are Vishama Visruti, Kharaparyanta, Thanuni, Udrutta Bahistanuni, and Krishita Lomachita. Right? We will take these four. Now, how they present? How they present? For example, Vishama Visrutani. Vishama Visruti means that the lesions are spreading irregularly. They do not follow any pattern. They do not follow any pattern. For example, when we say psoriasis, psoriatic lesions are seen on extensor surface and all. So if it is completely Vata dominant psoriasis, then we do not find that it is following the natural distribution of psoriasis because Vata is Vishama Visruti, irregularly spreading. Okay, irregularly spreading. There will be no symmetry or something like that. Irregularly spreading. Khara paryantani means a rough margin. You need to feel that when you touch, for example, psoriasis we are discussing. So when you touch the patch, the flake and all, it is smooth, right? It is smooth. It's not rough. It is smooth. Shlakshna sparsha. But when you go to edges, if it is Vata dominant, then those edges will be rough. That is what is Khara paryanta. Margins will be rough. Okay. Tanuni, lesions will be thin. Lesions will be very thin. Even if scales are there, they will be very thin. Tanuni, Udrutta Bahistanuni. There will be thin, scaly skin. Thin scaling or thin, scaly skin. Right? These are the Vaataja Lakshanas. Now, how to assess them in clinical practice? How to assess them in clinical practice, that we will see with the patients. We'll take these four patients only, right? So all the four are psoriasis, and we will take them for assessment of dosha, right? When dosha assessment, how important it is in psoriasis, you will understand. Now I have labeled it as pitta-kapha, pitta-vaata dominant condition. Now I'll give 10 seconds. Please try to make out what are those pitta lakshanas you are finding in this and what are the vata lakshanas, right? Can you make out any of the pitta lakshanas and any of the at least few of the vata lakshanas in this? Vaataja lakshanas we have seen, right? Pitta lakshanas with the help of basics, whatever you have based on that. Okay. So what are the pitta lakshanas? Pitta lakshanas are raga, that is redness, sneha, right? Oily appearance, ashugati samuttana, quick onset and spread. This patient developed this in span of 15-20 days. Whole body he developed this psoriasis type of psoriasis in just 15-20 days. Might have started as some adverse reaction to some medicines and all, maybe, but developed in very short span of time. So what it is? Ashu Gati Samta. Quick onset and spread. Onset is also very quick and spreading is also very quick. Right? These are the pitta. What are the Vaataja lakshanas? Thin lesions. Tanuni. Tanuni. That is macular, nearly macular lesions. Right? Thin, very thin. Thin scales. Tanu Udrutta Bahistanuni. Thin scales. And irregularly spreading. You can see it has acquired whole body. There is no pattern, there is no rules, nothing. It's not following anything. Abnormally, it is spreading. Irregularly, it is spreading. Right? So that is why we need to understand them. By seeing them, we can understand. If you are new to my channel, please subscribe. And if you like this video, please like it. If you feel it is worth, valuable, please like the video. And if you have any questions, any suggestions, please write them in the comments. And also your opinions about this video. And please share this video with your friends and whom you feel to be in need of this. Please share. Okay, so pitta-vaata we saw. Now pitta-kapha. Intentionally I have put them because to make it clear, even if we are discussing very few cases, but it should become clear, right? Now this is pitta-kapha. I think now we can make out pitta lakshanas, right? Same redness, tamra or raga, oily appearance, right? Those are the pitta lakshanas. Now why kapha lakshanas? Why not vata? Right? Because kapha lakshanas are elevated bahala. Bahala is kapha lakshana. So here the lesions are not macular, they are papular, raised lesions. Mruduni, soft to touch. They are soft to touch. Smooth and stable. Sthira, snigdha. Snigdha and sthira margins. Right? Now this is Tridosha. It has got Vata also. Now Vata lakshanas are again, this is also irregularly spreading. Irregularly spreading. On trunk also is having upper extremities and trunk is having. This is irregularly spreading. That is Vishama Visruti. And the scales are thin. Lesions with thin scales. They are elevated, papular, but Udrutta Baisan is scales are thin. Thanu Udrutta Baisan, right? Thin scales. So that is why it is Pitta Kapha. Now compare them. This is Pitta Vata because Pitta Lakshana is common in both. What is the difference? Why it is Vata? Because the lesions are thin. Here the lesions are bulkier. They are elevated. Macular nearly and here papular. So that is why it is Pitta Kapha and this is Pitta Vata. Right? We are taking Pitta Kapha now. Pitta Kapha we are telling, but same Pitta Kapha. Now this is Pitta Kapha presentation in psoriasis. Now this is a Luta Visha. You can call it as vesiculobullous type of presentation or you can call eczema type of presentation. Okay, no problem. Eczematization of lesion is there. This is also Pitta Kapha. This is also Pitta Kapha. Swabhava of the Roga. Acharya told us Swabhava Prabhava. Nature of the disease changes because this is a scaly disease. Right? Psoriasis is scaling. Scaling will be there. So that is why even with Pitta Kapha, the presentation is like this. Vata is also there. As it is a Kleda Bahula Roga, here the Pitta Kapha presentation is like this. So what is very important, even Dosha assessment varies from context to context. Context to context also. So what Lakshanas of Pitta Kapha we see may not be, they should not be the same in eczema. Right? What Vaataja Lakshanas we see in psoriasis, it's not compulsory that same should be seen in lichen planus. Right? So that is context is also important. So if you want to practice Ayurveda dermatology effectively and if you are still learning also no problem. Anybody final year BMS onwards, I have a 50 hours online dermatology course. It's completely online. 30 hours Ayurveda psoriasis management mastery in Ayurveda and 20 hours is dermatological manifestations due to Visha. In that dermatological manifestations due to Visha, you will learn about dermatitis, various types of dermatitis, allergic dermatitis, contact dermatitis, drug-induced skin disease and all. Actual price is more than 10,000. On our platform, the price is 7,000, but exclusively for my YouTube audience, I'm giving 700 rupees discount. Link is there in the comment. Link is there in the description, and you use the promo code YT YouTube YT 700, and you will get again additional 700 rupees discount. It's a very unique course. Anytime you can watch. Lifetime access, pre-recorded videos, no restriction of time and all. Right? Okay. Now we'll see the third case, right? This is Vata Pitta dominant. This is Vata. Previously Pitta Vata. Now this is Vata Pitta. Why? Lesions with thin scales. You can see scales, thin scales are there. Irregularly spreading, Vishama Visruti, have rough margins. Margins are rough. And what are the Pitta lakshanas? Redness and oily appearance. Redness and oily appearance are the Pitta lakshanas. Now, Vata Pitta, Pitta Vata. I think you can make out the difference. Vata Pitta, Pitta Vata. When you look into this patient, what is striking? The skin, thin scales are striking our eyes. When we look into this, erythema and oiliness is striking. So that is why it is Pitta dominant. Pitta comes first here thin scales are striking, so Vata comes first. And you can note, make out that roughness also in this, right? Now, Kapha Vata dominant. This is Kapha Vata dominant. Kaphaja Lakshanas well defined. Mandalani, whitish, Shweta, stable, Sthira, Bahala elevated, slow spreading. Manda, Gati. Right? Vaataja Lakshanas, Ruksha and Khara. Ruksha and Khara. Rough margins, Khara Paryanta, you can see. Tox Putan is also there. That is also Vaataja Lakshanas. Right? So this is, here also you can see Khara Paryanta. Both are same patient. These are the upper extremities, these are lower extremities. Right? This is Kapha Vata. Now again Kapha Vata context. Now Kapha Vata in psoriasis is like this. Kapha Vata in allergic footwear dermatitis is like this. If allergic footwear dermatitis presents with Kapha Vata dominance, it will be like this. So context is very, very important. So why we need to learn dosha assessment? Why we need to learn dosha assessment? Because sarvam tridoshayam pushtam doshanam tu balavalam yata swair lakshanam buddhya yata swair lakshanair buddhva pushtanam kriyate kriya. But Acharya says, Sargacharya says, all the pushtas are tridoshayam. Their determination is dependent on balabala, means which dosha is dominant, which is next, like that, right? Yata swair lakshanair buddhva. So, which dosha is dominant and all, how to understand them? We have to understand them by buddhva means by lakshana, by lakshanai. Lakshanai means by lakshana. We have to understand which dosha is dominant and all. Kriyate kriya. The treatment should be planned, right? Hope you understood. And if you want to practice Ayurveda dermatology, you join my course and you will get 700 rupees additional discount, and link is in the description, right? Okay, for more details you can contact me, and if you feel this video is worth, please like, and if you are new to my channel, please subscribe, and if you have any queries, any suggestions, and your views, your feelings about this video, please write them in the comments, and please share the video to the maximum number of your friends and the people who are in need. Okay, thank you for watching. See you again in next session, next video or next session related to Ayurveda dermatology, and keep studying. Take care. Namaste.